Breast cancer is a complex disease that affects millions of women worldwide, cutting across all demographics and regions. It occurs when cells in the breast grow abnormally, forming a tumor that can be either benign or malignant. While the exact causes of breast cancer are not fully understood, ongoing research continues to uncover new insights. There are several risk factors, including family history, genetics, and lifestyle choices, such as diet and exercise. Early detection is crucial in the fight against breast cancer, as it significantly improves treatment outcomes. When detected in its early stages, breast cancer is highly treatable with a variety of medical interventions. These treatments can range from surgery and radiation to chemotherapy and targeted therapies. The chances of survival are significantly higher when the disease is caught early, leading to more success stories. That's why it's essential for women of all ages to be aware of the signs and symptoms of breast cancer, and to seek medical attention promptly if they notice any changes in their breasts, such as lumps or unusual discharge. This essay will delve into the various symptoms of breast cancer, both common and less known, providing a comprehensive overview. It will emphasize the importance of early detection through regular self-examinations and screenings, which can be life-saving. By understanding the warning signs and taking proactive steps, women can play an active role in their breast health. This proactive approach can potentially save their lives and improve their quality of life. Remember, knowledge is power, and being informed is the first step towards early detection and effective treatment. Stay informed, stay vigilant, and take charge of your health to combat breast cancer effectively. Early detection is crucial in the fight against breast cancer. When detected in its early stages, the tumor is usually smaller and confined to the breast, making treatment more effective and less invasive. Early-stage breast cancer often has a higher survival rate compared to later stages. This is because treatment options are more limited and less likely to be successful when the cancer has spread to other parts of the body. Regular screenings, such as mammograms, play a vital role in early detection. These screenings can detect breast cancer even before any symptoms appear, increasing the chances of successful treatment and recovery. By being proactive about their breast health and seeking medical attention promptly, if they notice any changes, women can significantly improve their chances of early detection and increase their likelihood of a positive outcome. One of the most common symptoms of breast cancer is a lump in the breast or underarm. This lump may feel hard, irregular, or painless, and it's important to have any new lump checked by a healthcare professional as soon as possible. Another common symptom is a change in the size or shape of the breast. This could include swelling, shrinkage, or a difference in the appearance of one breast compared to the other. Any noticeable changes in breast size or shape should be reported to a doctor. Skin dimpling or puckering is another warning sign of breast cancer. This occurs when the tumor pulls on the skin, creating a dimpled or pitted appearance. It can resemble the texture of an orange peel and is often a sign of more advanced breast cancer. It's important to note that not all breast lumps are cancerous. However, it's always best to err on the side of caution and consult a healthcare professional for a proper diagnosis. While a lump in the breast is a well-known symptom of breast cancer, there are other, more subtle changes that women should be aware of. These changes can sometimes be overlooked, but they are equally important to recognize. These changes may not always indicate cancer, but it's essential to bring them to the attention of a doctor for further evaluation. Early detection can significantly improve the chances of successful treatment and recovery. One such change is nipple inversion, where the nipple turns inward instead of protruding outward. This can be a natural occurrence for some women, but if it happens suddenly, it should not be ignored. While this can be a normal variation for some women, it can also be a sign of breast cancer, especially if it's a recent development. It's important to monitor any new changes and discuss them with your healthcare provider. Another subtle change to watch out for is redness or scaling of the nipple or breast skin. These skin changes can sometimes be mistaken for a rash or infection, but they can also indicate something more serious. This could be a sign of inflammatory breast cancer, a rare but aggressive form of the disease that often presents with skin changes rather than a lump. Inflammatory breast cancer can progress quickly, so early detection is crucial. Any unusual warmth, swelling, or thickening of the breast tissue should also be taken seriously. These symptoms can be easily overlooked, but are important indicators of potential issues. These changes may be accompanied by pain or tenderness, or they may be painless. Either way, they should not be ignored, as they can be signs of underlying conditions that need medical attention. Regardless, it's crucial to consult a doctor for a proper diagnosis. Only a healthcare professional can determine the cause of these changes, and recommend the appropriate course of action. Remember, being vigilant about your breast health and reporting any unusual changes to your doctor can make a significant difference in early detection and treatment. Regular self-exams and professional checkups are key to maintaining breast health and catching any issues early. Section 5. Nipple discharge and its significance. Nipple discharge, while often benign, can sometimes be a sign of breast cancer. It's important to pay attention to the color, consistency, and whether the discharge occurs spontaneously or only when the nipple is squeezed. Clear, milky, or yellow discharge can be normal, especially during pregnancy or breastfeeding. However, bloody or blood-tinged discharge is always a cause for concern and should be reported to a doctor immediately. Discharge that occurs spontaneously, without squeezing the nipple, is also more likely to be associated with an underlying condition, such as breast cancer. If you notice any spontaneous discharge, it's crucial to consult a healthcare professional for further evaluation. It's important to note that not all nipple discharge is a sign of breast cancer. However, it's always best to err on the side of caution and seek medical advice to rule out any serious underlying conditions. Section 6. Skin changes, a red flag. Skin changes in the breast area can also be a warning sign of breast cancer, and it's essential to be aware of these changes and report them to a doctor promptly. Early detection can make a significant difference in treatment outcomes. These changes may involve the skin on the breast, nipple, or areola. Paying close attention to these areas can help in identifying potential issues early. One red flag is the development of redness or a rash on the breast skin. This redness can sometimes be mistaken for an infection or other benign conditions. This could be a sign of inflammatory breast cancer, a rare but aggressive form of the disease that often presents with skin changes rather than a lump. Inflammatory breast cancer can progress rapidly, making it crucial to seek medical advice without delay. Another concerning skin change is the appearance of dimpling or puckering, which can resemble the texture of an orange peel. This dimpling effect is caused by the tumor pulling on the skin, creating a distinctive appearance. This occurs when the tumor pulls on the skin, creating a dimpled or pitted appearance. It's a visual cue that should not be ignored. Any new sores, ulcers, or changes in skin texture that don't heal within a reasonable timeframe should also be brought to the attention of a healthcare professional. Persistent changes are often a sign that something more serious may be occurring. It's important to remember that not all skin changes in the breast area are cancerous. Many benign conditions can cause similar symptoms. However, it's always best to err on the side of caution and consult a doctor for a proper diagnosis. Early consultation can provide peace of mind and ensure that any necessary treatment can begin as soon as possible. Section 7. Breast pain. Should you worry? Breast pain, also known as mastalgia, is a common concern among women. While most breast pain is not related to cancer, it's essential to be aware of the different types of breast pain and when to seek medical attention. Cyclical breast pain, which fluctuates with the menstrual cycle, is very common and usually not a cause for concern. It's often caused by hormonal changes and typically affects both breasts. Non-cyclical breast pain, on the other hand, is not related to the menstrual cycle and may affect one or both breasts. It can be caused by a variety of factors, including injury, fibrocystic breast changes, or in rare cases, breast cancer. If you experience persistent breast pain, especially if it's localized to one area, doesn't go away after your period, or is accompanied by other symptoms, it's crucial to consult a doctor for further evaluation. Remember, while most breast pain is benign, it's always best to err on the side of caution and seek medical advice to rule out any serious underlying conditions. Regular breast self-exams are an important part of breast health awareness. While they can't detect all breast cancers, they can help you become familiar with your breasts and notice any changes that may occur. The best time to perform a breast self-exam is a few days after your period ends, when your breasts are less tender. If you're not having periods, choose a day each month to do the exam. Start by visually inspecting your breasts in the mirror, looking for any changes in size, shape, or skin appearance. Then, raise your arms overhead and repeat the visual inspection. Next, lie down and use the pads of your fingers to feel for any lumps or thickenings in your breasts. Use a circular motion and cover the entire breast area, including the armpit. Finally, repeat the palpation while standing or sitting, as some lumps may be easier to feel in this position. Regular screenings, such as mammograms, play a crucial role in detecting breast cancer early, often before any symptoms appear. Mammograms are low-dose X-rays that allow doctors to see inside the breast and identify any abnormalities. The American Cancer Society recommends that women at average risk of breast cancer start getting mammograms at age 45, with the option to begin earlier at age 40. Women at higher risk, such as those with a family history of breast cancer, may need to start screenings earlier and more frequently. During a mammogram, each breast is compressed between two plates for a few seconds while X-ray images are taken. While some women may find the compression uncomfortable, it's important to remember that it's a quick and vital part of the screening process. Regular mammograms, along with other screening methods such as breast ultrasounds and MRIs, can significantly increase the chances of detecting breast cancer early when it's most treatable. If you notice any unusual changes in your breasts, such as a lump, skin changes, nipple discharge, or any other concerning symptoms, it's crucial to seek professional medical help immediately. Early detection is key in the fight against breast cancer, and a prompt diagnosis can significantly improve treatment outcomes. Don't hesitate to schedule an appointment with your doctor or a healthcare professional if you have any concerns about your breast health. They can perform a clinical breast exam, order additional tests if necessary, and provide you with personalized advice and support. Remember, you are your own best advocate for your health. Don't be afraid to ask questions, seek second opinions, and advocate for yourself throughout the diagnosis and treatment process. In the fight against breast cancer, knowledge is power. By being aware of the signs and symptoms of breast cancer, women can take proactive steps to protect their health and seek medical attention promptly if they notice any changes. Early detection is crucial in improving breast cancer outcomes. When detected in its early stages, breast cancer is highly treatable, and the chances of survival are significantly higher. Remember, you are not alone in this journey. There are numerous resources available to provide support, information, and guidance. Don't hesitate to reach out to your healthcare provider, cancer organizations, or support groups for assistance. By staying informed, being proactive about our breast health, and seeking professional help when needed, we can significantly impact the fight against breast cancer and improve outcomes for women everywhere.